Hi, everyone. Thank you for joining. Sorry for a bit late start here. Had some technical difficulties, but we're going to let everyone join in on the webinar, give some moments here for the numbers to tick up and the connections to get started. But as we're waiting here, I just want to acknowledge our wonderful series sponsors that make this event happen and support our work at WEHN. And just want to thank our amazing sponsors while everyone is joining. So thank you, and thank you to SSM Health, who provides our accreditation services for our continuing medical education services. So let's see here. I see the participant numbers are going up, so that is great. I am going to move on to the next slide so we can keep on moving. So let me go. So my name is Hannah Mortensen, and I am the Executive Director of the Wisconsin Environmental Health Network, which is an environmental program of Physicians for Social Responsibility Wisconsin. WEHN, or WEN, is a program that exists to provide health professionals a place to advocate for environmental health and the protection of public health here in Wisconsin. We provide educational resources like this health series, as well as tools and resources on our website. We advocate for public health protections and to provide education for our elected officials. We strive to bring the public health voice to environmental issues in Wisconsin. As you can see, there's our website. We always encourage you to go online and to like us on Facebook or follow us on Twitter to stay up to date on our upcoming events, our news, or action alerts. I will now go over just what you can expect about this presentation. I imagine most of you have been on Zoom before, but just a brief overview. We are on webinar mode, so you will not be able to see other attendees. You will be able to see panelists, so that includes Trish, myself, and Claire. Attendees cannot speak or be seen. Just so you know, this event is being recorded and will be placed on YouTube in the next week. To submit a question, please use the Q&A box located on the bottom of your screen. It has two bubbles and actually just says Q&A on it. You can submit a question at any point during the presentation, and we will have a time dedicated for questions at the end of the presentation. And at that point, we will try to address as many questions as we can with a stop at around 8 o'clock. If you are calling in, press *9 or email us at wehnmail@gmail.com. And then to change the view of the presentation, you will often have an icon in the upper right-hand corner of your screen, or there will often be a vertical slider on your screen to adjust a presentation versus the video screen of the person speaking. And this may be different if you are joining from the app, and of course by phone, you will not be able to view the screen. So with that, I'm going to turn it over to Claire Gervais, our co-director, co-president of WEHN, to hand it over to her.
Thanks, Hannah. So I'm Claire Gervais. I'm one of the co-presidents of this group, and I've been active with it since 2011. There are multiple health professionals in our group: nurses, midwives, environmental scientists, and others that are interested in environmental health and connecting so that we can work on advocacy and education together. And we have a steering committee that I would like to invite any of you that would like to get more active, to reach out to us and join us on the steering committee. We do a lot of great work there, and we're always looking for new members to become more active. So Hannah will put something in the chat as to how you can connect to us if that's something you're interested in, and we can reach out to you about that. I'd like to introduce our speaker tonight. This is Dr. Trish Koman, and she's an assistant research scientist at the University of Michigan School of Public Health and Environmental Science, Health Sciences Department, and the faculty research program manager at the College of Engineering Multidisciplinary Design. She leads community engaged research to create healthier communities. She draws from 20 years of public service as a senior environmental scientist at the US EPA, working mainly to improve air quality. She was part of a leadership team for the US EPA's National Clean Diesel campaign, where she initiated a partnership to reduce diesel emissions at US marine ports and helped create the Clean School Bus USA Partnership Program to protect children's health. Her air quality and policy analyses formed the rationale for setting landmark national ambient air quality standards for fine particulate matter, which withstood a challenge to the US Supreme Court. She's been recognized with 4 gold medals for exceptional service to the country and an EPA Administrator Award for Excellence. In partnership with community groups, Dr. Koman led an environmental education effort in Flint, Michigan. She received a University of Michigan Provost Award for innovations in teaching. She was also recognized by the American Public Health Association with a Distinguished Service Award for her work with the environmental section. And recently she let us know she's going to be leaving the University of Michigan soon and joining back to the US EPA in mid-March. Would like to congratulate her on this new opportunity. And now Dr. Trish Koman will speak on health and chemical policy, what every health professional needs to know to make TSCA work to protect vulnerable populations.
Great. Thank you so much for that kind introduction and for the chance to be here. It's so wonderful that your group here in Wisconsin is interested in making the connection between the environment and health at such an important time. I'm going to go ahead and share my screen. Excellent. So thank you again for allowing me to present tonight. I do want to disclose that I have an outside interest with future employment with the U.S. Environmental Protection Agency, and that my remarks are my own opinions and information and do not represent that of any organization or funder. So tonight I want to talk about the Toxic Substance Control Act and how health professionals can get involved. So we know that there are widespread exposures to chemicals and that these are increasing risks and harming our health. President Biden has recently announced a cancer moonshot and mentioned the environment and environmental causes contributing to these important diseases. There's an urgent need for primary prevention to keep harmful chemicals from increasing risks to vulnerable populations. And healthcare professionals can play a really important role, but we're often siloed. Oftentimes environmental issues are not connected to healthcare providers. And it's so important for healthcare providers to use their trusted voice to provide data, to summarize the science, and to advocate for health protective policies. In fact, for too long, the US hasn't had adequate laws to prevent products that harm the public's health, especially for children, people starting a family, pregnant women, for workers, for aging populations, and for people who've suffered from the long-term effects from a variety of chronic diseases, and indeed from COVID as well. So the positive news is that in 2016, a new law with bipartisan support gave the US Environmental Protection Agency some new authorities. And I'll be talking about these. And there's important roles for health professionals to weigh in on key scientific issues and to advocate for the most health protective implementation of this new law. So I want to talk a little bit about the background and motivation for this work. So as a public health scientist, I want to talk a bit about my stance and to make my values transparent. So what we really want to see here is a future in which health and justice are core values, and that the routine outcome of our environmental laws and policies at all levels is the equal protection and not environmental inequalities or increased risk for people. Too often times, there has to be this heroic effort to make our laws work for our most vulnerable populations. Indeed, our children are especially susceptible to risks from environmental exposures to chemicals, and the health of the next generation is at stake. So this is a really important time to get involved in these topics. Indeed, we know that a number of chronic diseases for children are increasing, including cancer, asthma, and developmental disorders. In the last few decades, we've seen rising trends in these and a big jump in childhood cancers. And studies find that environmental exposures contribute significantly to increased risks in these kind of diseases. And this is why we're so interested in moving forward with reducing environmental exposures to chemicals. These chemicals are linked to health harms, including things such as IQ loss, autism, cancer, infertility. And these can have a long impact on people's lives. In fact, babies are exposed to environmental chemicals before they're born. Over 43 industrial, commercial, and consumer product chemicals are routinely detected in pregnant women from an NHANES study. And this is of concern because many of these chemicals are developmental toxicants, and the prenatal period is a critical window of susceptibility for the fetus. Chemical production has been on the rise. Since World War II, there's been a 15 times increase, and the number and diversity of chemicals is also increasing. And these are in products in everyday use that we come into contact with. So our flooring, housing materials, bedding, pajamas, personal care products, toys, dry cleaning, chemicals that people find on the job and in food packaging. It's all around us. And we also know that we need to understand exposures in the context of racial discrimination and inequalities and health inequities that are rampant in our country. Some communities, and here I have some statistics from Michigan, from Southeast Michigan. Some communities have multiple exposures from nearby industries, air pollution from roadway vehicle emissions, truck traffic, lead paint in our homes and in the dust in our older homes. And it's also a case where we have underlying disparities in terms of health outcomes. For example, in Michigan, we have higher rates of asthma in the Detroit area, higher age-adjusted cancer rates than the rest of the state, and a lot of concern about birth outcomes that are worse here than in other areas. So we can't lose sight of the health equity implications of these exposures. I think that's an important part of a public health perspective on these issues. The good news is that health professionals can make a big impact. In fact, when the public is surveyed, the public really expects that scientists will take an active role in public decision-making. So it's important that we stay informed, that we let leaders know that you're following along on these topics, that you're there as a resource should they need your help. You can discuss primary prevention as a really important way to stop exposures before the diseases develop. Share your data and information and advocate for public health safeguards. So let's talk a little bit about the Toxic Substance Control Act, old and new. So in 1976, President Ford signed into law the Toxic Substance Control Act. It has been widely recognized as being weak and ineffective and not doing much to stop these harmful exposures. There's three main gaps that have been identified in the literature regarding TSCA. The first is a data gap. Producers are not required to provide information and disclose sufficient information on the hazard of their chemicals or their products to the governments, to downstream businesses that use the chemicals, or to the general public. This created a large data gap for many years. Unlike pharmaceuticals or pesticides, where before these products go on the market, they're subjected to testing and disclosure, For TSCA, they basically grandfathered things in and allowed these products to be on the market. That contributed to a safety gap. The government lacked the tools and the legal authorities that it needed to efficiently identify, prioritize, and take action to mitigate potential health and environmental effects of hazardous chemicals. So even things like asbestos and methylene chloride, a solvent that is widely understood to be hazardous, could not be banned under this old ineffective law. And of course, there was also a technology gap where industry and government were not actively searching for better alternatives and not investing in education. And indeed, there's a large amount of chemicals in high volume production in the United States and elsewhere, and many of these are untested for their health effects. The good news is that in 2016, thanks to a lot of effort on behalf of many advocates and others, with bipartisan support, the Frank Lautenberg Chemical Safety for the 21st Century Act was signed into law. This was a really exciting moment because chemical manufacturers for the first time would be needing to provide data before their new chemical products reach markets. EPA would have authority to prioritize and review and take action on the risks from existing chemicals. And the EPA also had mandatory deadlines to complete these risk evaluations and risk management steps on enforceable deadlines. For me, this is really an important moment. As Claire mentioned in the introduction, I've spent my career working on air pollution issues. And in 1990, the Clean Air Amendments were passed into law. And that was a really exciting time to join in on these topics, and a whole world and new opportunities and a new field developed. And we're really at that moment for TSCA. And so if you haven't really understood the Toxic Substance Control Act, it's really something worth investing your time in, because there's going to be a lot of career opportunities and a lot of action on this area. So it's a really exciting time to get involved in this really important law. So I want to take a minute to talk through the process for providing a risk evaluation for existing chemicals. So these are chemicals already in commerce. So the first step is prioritization. The second step is a risk evaluation step. And then the third and final step is risk management. And I'll walk you through each of these. So for prioritization, EPA must first prioritize chemicals into low and high priority buckets. The high priority chemicals are subject to what's called a pause preemption. This blocks state action on these chemicals while they're going through the next steps, which is the risk evaluation. Then EPA evaluates whether the chemical poses an unreasonable risk to health or the environment, including to susceptible and highly exposed populations. If it finds no unreasonable risk, that final determination then preempts states from taking action on that chemical. If it finds an unreasonable risk exists, then EPA will move to the risk management phase. And in the risk management phase, at this point, costs can also be considered, and EPA will issue rules to reduce the risk. It also preempts states from taking further action on the chemicals. So EPA started with its first 10 chemicals, and it's now proceeding towards a next set of 20. And it has enforceable deadlines and schedules to compel EPA to continue to make headway on these processes. So EPA has a lot of work to do. And as I mentioned, we have quite a data gap from 40 years of not gathering information. So there's a lot of work to be done. For high priority chemicals, they undergo a risk evaluation where EPA uses a systematic review to summarize the literature to determine whether a chemical substance presents an unreasonable risk of injury to health. And the really important change for the 2016 amendments is that now EPA's determination must be made without consideration of costs or benefits of the regulation. That the health determination is made on a health standpoint, not on these other considerations. EPA also has a deadline where they must complete the risk evaluation in 3.5 years. In making these determinations, EPA also needs to consider risks to potentially exposed and susceptible populations. These are groups that are either due to their greater susceptibility or greater exposure, can be at greater risk than the general population of adverse health effects from chemical exposures. And the law in the amendments identifies infants, children, pregnant women, workers, and aging population as examples of these vulnerable populations. And it's really important to note that workers are called out specifically. And so there's a new authority here for EPA to be able to specifically look at workplace exposures. And so if you are from the occupational health professional side, this is a really important time for you to get involved in TSCA, because this is a new authority to look at workers' health and a great way to do primary prevention upstream. So in conducting risk evaluations, EPA also looks at what they call conditions of use. And this is a really important term of art in the law to understand. So EPA should be evaluating exposure to chemicals under all the conditions of use. So any kind of combination of activities where the chemical is manufactured, processed, distributed, used, or disposed of, its whole life cycle of the chemical. So a couple things to understand about the risk evaluation basics. So a chemical's risk is based on its health hazard, such as its toxicity, for example, to the brain and the level of exposure. And then to capture the total amount of a chemical that people are exposed to, EPA should be adding up all of the exposures from all of the pathways. One thing to note that if we exclude some of the exposure pathways, the risks will be understated. And I've got this photo of a set of donuts here, because sometimes when we're doing chemical risk assessments, we break things apart. So we might evaluate, let's say, the sprinkles or the frosting or the donut cake itself by breaking apart the pathways such as inhalation, understanding our ingestion, or if we're drinking water or eating food with a chemical in it, or dermal exposure. But if we don't put those all together, it's like going on a diet and saying, oh, I just have to worry about those sprinkles. I don't have to count the calories from these other things. But from our body's perspective, it matters that all of these pathways lead into our body. And so it's a really important basic principle of risk assessment to aggregate the exposure pathways. So as EPA is determining that there's an unreasonable risk, then the law requires that EPA adopt rules that restrict the use so that the chemical substance no longer presents a risk. And the risk management measures can range from full bans to labeling requirements, for example. And then if EPA determines that there is no unreasonable risk, that determination is final, and then state and local government cannot take additional steps to regulate the chemical. So I mentioned that EPA has already begun with the first 10 chemicals. And so here's a list of the chemicals that EPA has been evaluating to date. And they're starting on a second list of 20 chemicals. And as they complete these risk evaluations, they add new chemicals from their work plan. So let's turn now to a few of the key scientific issues in TSCA implementation. So I wanted to point out that there's a number of important documents that would help you to sort through these different pieces. And I have been working with the University of California, San Francisco Program for Reproductive Health and the Environment. And they've created several recommendations to EPA, and they have been following the TSCA implementation very carefully and closely, and have provided over 40 public comments in the last several years on the risk evaluations. And so they have a set of recommendations that you can take a look at. that have been supported by over 70 experts and other organizations nationally. And these are recommendations that build upon the National Academy of Sciences recommendations from 2009 and other issues. These include using health protective adjustment factors for the variability and vulnerability of population, adding up and aggregating risk, as I just described, thinking about cumulative environmental exposure frameworks, and thinking about health equity in these reviews. So here's a few of the issues in TSCA risk evaluation. So EPA has been assuming that if a different law or statute exists, then that pathway does not need to be considered under TSCA. This administration is reversing that position from the previous administration. So for example, 1-bromopropane was recently listed as a hazardous air pollutant, but it hasn't been regulated in the same language under TSCA does not apply in the Clean Air Act. So there's some gaps there. In the past, EPA has also allowed to set aside a water contaminant that might have a limit, even if the limit is not being enforced, for example. So this is something that is an issue that needs some ongoing attention, is starting to be addressed. Another example is that EPA has limited the conditions of use in its risk evaluations in the first 10 and claimed that the EPA administrator has full discretion to select and exclude or consider separately conditions of use. So if you think about that donut again, it would allow EPA to be able to pull apart the different pieces and evaluate only that and not add them up. So this is being partially addressed under the a revision of the risk evaluations by this administration, but is something that I think will merit some more attention. I mentioned that EPA has new authorities for worker protection. Previously, the EPA was assuming that workers have full access to and wear their personal protective equipment at all times. EPA announced last year that they would be revisiting this assumption based on data and would be going forward with risk evaluations that make more realistic assumptions. So again, this is an area where occupational health professionals could really assist the agency in understanding what's really happening out in the field and in workplaces. So just to cover a few more of these key issues, EPA does not aggregate inhalation, dermal, and oral exposures in its risk evaluations, although one would argue that they should be doing that. EPA does not consider cumulative risks, for example, for overburdened communities where people might have multiple roles related to conditions of use. So you could think about a pregnant worker who's also a consumer of the same chemicals in consumer products, for example. And then both the National Academy of Sciences and many states use more protective uncertainty factors than the EPA does. And so these can be improved as the science advances. So there's several ways to find out more information about these topics and how to educate yourself and help to comment on the different documents that EPA is putting forward and to educate others about this. I have been involved in a group that's called the Environmental Protection Network. It's a not-for-profit group that has published a report called Resetting the Course of EPA. And they have several chapters, one related to toxics and the Toxic Substance Control Act, and then another related to environmental justice issues. And I recommend that you take a look at their recommendations. At Michigan, I organized a program in 2018 to talk about the National Academy of Sciences report using systematic review to evaluate population level dose toxicity from endocrine active chemicals. It's a bit of a mouthful, but it basically, the authors of this very important landmark report walked us through the key recommendations. And it's a lovely video that would help you understand some of these really important topics. So there are many opportunities for health professionals to engage besides just learning about these issues. And so I have a few recommendations here. So one of the things that we can do is to make environmental health part of our medical care, that we can ask for information as we're taking health histories, and to consider that as we're advancing our medical care and our health care. We can also educate providers about environmental laws so that they can become more cognizant of places where they can be engaged for primary prevention. We should also be championing anti-racist approaches to eliminate health disparities. And we can also work through professional associations and medical societies, such as this group, to help better understand and advocate for these issues. Specifically with regard to TSCA and EPA, there's several opportunities for public comment and input. And here are just a few that I think I'd like to highlight for you. The first is when EPA is setting its prioritization of chemicals, so the chemicals that are being listed for evaluation. Health professionals can provide data about patient or worker concerns and priorities, data about susceptibility and health effects. And if you're going to be submitting a public comment relying on literature, you want to be sure that you also attach a copy of the literature that you're citing. The second area is in the risk evaluation process. I mentioned that these will be going on for a couple of years, so it's 3.5 years typically for those to be happening. So there's several places where you can provide your comment. The first would be in the scoping documents, where EPA lays out its scope for the conditions of use, the exposure, susceptibility, and health effects that it would be examining. The second is the problem formulation document, and the third would be the draft risk evaluation. And so I would really recommend considering providing comments at each of these levels. And also EPA reaches out with environmental justice consultations, and those are open to the public. The third area where health professionals can really provide a lot of good information is in the risk management phase. And data about conditions of use, costs, and impacts are all very relevant here. And of course, the advocacy for health protective policy is also very important. There's a number of groups that provide information and testing and consumer campaigns and information that is very credible and that can help individuals who are trying to reduce their personal impact and their personal exposures. And also sometimes procurement professionals who may be working in your health system who want to know, well, how do I find a better cleaner that is less toxic? So there's a number of resources available. If you want to learn more about TSCA, I recommend a couple different recording programs that are available. There were a number of things done on last year for the 5th year anniversary of TSCA. So I helped to organize and spoke at a couple of these, one at the University of Michigan, and here is one on the UCSF. And then on March the 8th, we've got a program coming up that I'm very excited about that will be going through some more details about probabilistic risk assessment techniques and understanding how you can advocate for health protective techniques and in risk evaluation. So I want to just end my formal comments trying to come back to this statement of value, that really what we're trying to do is to advocate for a way that health and justice can be seen as core values, and that the routine outcomes of our environmental laws is the equal protection and the promotion of health. And I think that we can work together to make those values become a reality by following the recommendations that I've laid out for you. And with that, I'm happy to take questions. And I'd like to acknowledge my funding as well. Thank you.
Well, thank you, Trish, so much for your presentation. Greatly appreciate the information you shared, as well as all the links. I tried to, as it was going, share those things in the chat. So if anyone was interested, I shared several links in the chat. And then when I do the follow-up email in a week with the recording, I'll also include as many of those links as I possibly can. So we have a number of questions today. So again, people continue to submit your questions through the Q&A, and we will try to get as many addressed as we possibly can. It looks like we have a good amount of time, which I'm thankful for because Q&A is very popular. So Trish, are you ready?
Sure, yeah.
Okay, great. So our first question, I did not see PFAS on the priority list. Are they? If not, shouldn't they be, or do you think they should be?
Yeah, that's a great question. So PFAS is getting a bit of attention in Congress with other laws, as is asbestos and methylene chloride. And one of the things that's kind of interesting about this process is if we have thousands of chemicals, if each and every class of chemical needs its own statute for protection, we're going to have thousands of laws instead of one centralized place to address these issues. So I think that PFAS are very important, and the agency in their prioritization did not have that as one of the places to begin, because it had other priorities that had been on the prioritization list. But I will say this, if you feel that that's more important for some reason, get involved in the process by which EPA is setting its priorities. Also for PFAS and PFOA and other chemicals like this, EPA does have the ability to consider classes of chemicals. And so that allows it to think about essentially a bundle of similar chemicals to try to avoid things like regrettable substitution, where EPA may take action on one chemical and then its very close cousin gets put on the market, and then you have similar health risks occurring.
There's a couple of questions about cumulative and synergistic effects of combination of chemicals. Is this being evaluated? Is there a way to regulate that?
So interestingly, the TSCA amendments did not include cumulative environmental exposures or risk as a requirement. For aggregate risk, where you're adding up the pathways for the single chemical, the law requires that EPA say whether or not it used that. It doesn't require that they add them up. In its comments on its risk assessment and its response to comment, EPA said that it had concerns about overestimating risk because of the lack of toxicological pharmacokinetic modeling to put these together. But it did not acknowledge or discuss underestimation of risk by not adding them up. So that's within one single chemical. Currently, the US EPA has a document out for cumulative environmental exposure and risk assessments through its Office of Research and Development. And my understanding is that they've got a peer review meeting coming up in early March. And so if you're interested in these topics, taking a look at EPA's recent document would be very helpful. In addition, EPA issued fence line exposure information. So when EPA was identifying groups that might be highly exposed, they left out nearby or fence line communities. So if you live near a manufacturing site, for example. So EPA created a screening assessment, an example, if you will, to show how they would be doing these assessments. And they had 3 different chemicals that they used as examples to show how they would do air and water pathways. And that's out for review right now. The comment period is closing at the end of March, and there's a peer review panel meeting, I think next week on that as well. So a lot of activity on this area if you want to get engaged to understand better what EPA is trying to do there.
Thanks for answering that question, Trish. The next one's kind of about
I'm having
funding.
trouble
So
hearing you, Hannah.
can you hear me now?
Yeah.
Okay, get a little bit closer to the computer. Thank you for answering that question. The next one is, are taxpayers paying for these government evaluations, or are manufacturers contributing to paying for them? Or do you see a potential for manufacturers contributing to these risk analysis?
Yeah, so the law requires that EPA conduct those analyses, and so it squarely puts the burden on EPA to conduct these analyses. Should a manufacturer wish to do their own, they may do a risk evaluation and submit it to the agency for their review. And OTNE was one example of that. Unfortunately, unlike Europe, where the regulating agencies for the EU have the authority to ask for a bundle of data in advance, and they say, here's what you must submit to us. TSCA did not provide that specific information. I think that EPA could and likely has the authority to provide that in guidance so that manufacturers understand clearly what information they must provide to the agency. But right now, that's not the case. So the burden is on industry to provide the data to EPA. So the cost of providing that health data should fall onto industry. And there's also fees that industry pays that helps to run the program essentially. However, the Nonpartisan Government Accounting Office has identified that there is a management risk in the TSCA office, that they are underfunded, that they are not staffed up sufficiently for this new set of requirements. And that is going to hamper their ability to be able to move forward and meet deadlines. So there's really a need for more resources to this program.
Tricia, one of the you gave us some resources you had, or there it was a combination, I think, of authors, but one of the criticisms or one of the comments about the EPA is their ability to define unreasonable risk. Have they come closer to defining that?
I think this is something that's going to be debated, and as EPA finalizes their approach, it'll probably be litigated. But I think that that there's pretty clear information in the National Academy of Sciences 2009 Science and Decisions guidelines about how to conduct an adequate risk assessment, and that the agency hasn't stayed very close to those recommendations, but is under this administration starting to make more changes towards that end. These are pretty big asks of the agency to make these risk determinations, and there's a need to act with swiftness as well, because the exposures are ongoing. And so I think that the EPA needs to balance doing appropriate and thorough risk evaluations with steady progress towards the risk management phase.
So we've got another question here. We've got quite a few. They keep coming in, which is great. I love it. Is there a way to get past the defense of proprietary information when it comes to figuring out household and occupational exposure to brand name products?
Yeah, that's a great question. Sometimes it's really hard to know what's in a product. And TSCA, under old TSCA, allowed for a lot of information to be claimed as confidential business information under TSCA. In fact, sometimes even the name of the chemical was not revealed. New TSCA has new authorities. Those are starting to be explored. I'm not an expert on those, but I think that that's going to be certainly an area to be keeping up with. And hopefully there'll be more disclosure as a result of that. In addition, things going on in Europe under the REACH program will also make other data available that aren't available here. So as they are ahead of us, if you will, in time, they will be able to have information that the US can also use.
There's a couple of questions that are similar, so I'm going to read them both. Does the EPA have a mechanism for fast tracking in the case of chemicals that are clearly toxic? And another person asked, what emergency powers does EPA have to stop marketing of chemicals newly discovered to present serious health risks? Kind of the same question, such as for PFAS, but he mentioned.
Yeah, so I'm not a lawyer, and so I can't really give a definitive answer on that. However, groups that are looking into this do think that there is a pathway for EPA to take emergency actions to limit the exposures while at the same time they move forward with their risk evaluation process. This has come up in the case of methylene chloride, for example, because it kills people in a matter of minutes. And it's a product that you could just go to your hardware store and buy. And that's what a number of young workers were doing. And then they would become overcome with the fumes and tragically die. And there needs to be a way to prevent these tragic losses. Likewise, with longer term effects, we want to be able to prevent the start of the disease process. And so clearly we need to be making more headway to try to remove the risks as quickly as possible.
Thank you. We've got a question from Anne. Can citizens or groups propose chemicals for priority for evaluation? Similar
Yes.
to the way species can be proposed for threatened or endangered status.
So I don't know what the process for listing an endangered species is, but certainly people can propose and comment on EPA's prioritization. They had a work plan that lists the chemicals that they're considering in the data that they have available. Another thing to consider is EPA has a certain clock that begins as soon as a chemical is listed and they announce that they're going to be working on that chemical. Unfortunately, sometimes things like doing a second generation developmental tox study takes longer than the time frame that's allowed in the law. And so there's some discussion about trying to do a pre-prioritization process by which EPA identifies even more chemicals. The Obama administration had proposed something like that. The Trump administration decided not to do that, but that's an ongoing debate because there's a mismatch in terms of the time necessary for the science and the law's deadlines.
I have another question. Why is there a disconnect between, you mentioned this in your materials, between the IRIS, a branch of EPA assessing chemicals, and then TSCA? Maybe you can explain what IRIS is to everyone.
Yeah, so it's usually pronounced the IRIS program.
IRIS.
The IRIS program is part of the EPA's Office of Research and Development. And their disclosure, essentially, they're providing information and they provide review services to other parts of the agency and to state and local government and the public. TSCA, on the other hand, has a specific statute. And just kind of going back to Civics 101, the federal government agencies only do what they are authorized to do. So Congress has to tell them every muscle they're going to move. If they don't have authorization to do it, they really can't do much, or as much as they might wish to. So the TSCA governs the risk evaluations that are done under TSCA, and they have interpreted through their framework rules the evaluation of the science to mean a systematic review. And so there's some difference between how a systematic review is done, for example, in the IRIS program, and then EPA under TSCA proposed a different approach. And so there's been this tension between the two offices. When we look at evidence-based systematic review, such as OHIA in California, or the navigation guide that the University of California, San Francisco has, for example, that has been recommended by the Science Advisory Board to EPA. those approaches have not been utilized fully by the TSCA office, but are closer to what the IRIS system is using. The IRIS system, though, also is underfunded, and a lot of the IRIS assessments are pretty out of date because it takes a long time, many administrations sometimes, for them to complete their reviews.
All right, so next question is, what is being done to educate and inform health providers of health risks of chemicals already on the market and with which their patients are likely to be exposed? So I think they're asking, what education is there besides, what we're doing today, to inform health providers of the risks and how to communicate with their patients?
Yeah, maybe that's a question for Claire. I think that these sorts of forums are exactly what's needed to make those connections, and I think that there are not as many as necessary. I don't know if you want to add.
Yeah, I agree. Yeah, it's definitely not a priority, I would say, in the health profession. We still are talking a lot about what, family history of cancer, that sort of thing. There isn't that switch yet in the general medicine world. And I think it's coming, because especially with us discussing climate change and health more. And so I keep hearing speakers talk about that, but it really isn't a well-known connection. And so I think, programs like this, and the more we can actually go back to our respective healthcare groups and, present at that level, a lot of times these forums are wonderful, but you end up attracting the choir who already kind of knows about this. And so breaking through to our health groups, I think, is probably what needs to be done. It hasn't been done in any scale. So that's what I'd say about that. Let's see. There's a question from Jed. Has it been determined what type of data manufacturers will be required to provide? Chronic toxicity, reproductive toxicity, 1 or 2 generation studies, or just acute toxicity, LD50 type information?
Right. So this is where in the European Union, there's a specific set of required data to be provided. The United States does not provide that to manufacturers. So they don't provide the kind of guidance. They have authority to ask for studies to be conducted or for data to be obtained to fill in gaps that may exist in the literature, but it's for the existing chemicals on the market, there's not that list of types of studies to be done.
So I know you were talking about evaluation deadlines. So can the mandatory evaluation deadlines be extended under certain circumstances? And when that happens, can the chemicals be kept off the market pending those extensions?
So the chemicals that we're talking about are already on the market, and they typically maintain that while the risk evaluations are being done. There is some ability to get an extension, but typically what happens is EPA goes past its deadline. It can be sued by outside organizations to complete it in a quick way because it's missed its deadline. And then the parties negotiate over how that's done.
There was a comment about the question I answered, one of our other physicians, who said there are programs associated with the American College of Occupational and Environmental Medicine conferences that do some justice to educational opportunities. So if you're an occupational medicine doc, you may hear more about that. Let's see. There's the question about old TSCA. Do you agree that TSCA 76 has been mostly a failure given the stats you gave on chemical exposures already documented?
So yes, it's I have a publication talking about how TSCA has had difficulties. A lot of it has to do with a court case that came about where EPA was required to assess such a large multitude of alternatives that it essentially tied the agency's hands in terms of being able to do anything to regulate even known hazards like asbestos. So the old TSCA was largely understood to be weak and ineffectual as a law, and resulted in many years of lack of information. And we're just starting now to be able to have the authority for EPA to gather the information it needs, to have the procedures, to do the risk evaluations, and then to get to the risk management phase. And it's really very important that this law be supported in a way that allows it to continue to play out. I know people are frustrated that it's taking a long time, but 40 years of deficit in data is a long time to make things up. And so I know we're going to need to have different approaches to this. And my hope is that that they'll be able to get the resources that are necessary to try to advance on making the progress that we need. Unfortunately, at the slow pace that the law requires, it's going to be hundreds of years before they get through all the chemicals in the risk evaluation process. And so being sure that we are prioritizing correctly and getting to the high priority chemicals quickly is a really important thing to do. And I would really recommend that you consider trying to assist the agency with making good decisions about how they proceed, and providing as much data as possible.
Thank you, Trish. That's a good way to end it, actually, with something that we can do, for all of us to be involved, to speak up. So I think that's a wonderful way to end it. We don't have any more questions, actually. So I just want to thank you, Trish, so much for spending your evening with us, for speaking with us, and actually speaking for everyone that will watch the recording. For everyone that is still on right now, I just sent a link in the chat to our WEHN website where you can find some of the links Trish has mentioned. It's on our website, as well as information on various topics, including chemicals on our website and how to join WEHN. I want to thank Claire for joining us tonight. Thank all our sponsors. And Trish, do you have any last words before we close out tonight?
Yeah, I just want to say thank you so much. And please stay involved with promoting environmental protection and environmental justice causes. Thank you.
Thank you, Trish. And just a reminder to everyone, we have 2 more presentations left. So we'll see you on March 2nd and March 16th. Thank you all and have a good night.